Frequently asked questions. If I go into labour with a propest pessary or balloon, what happens next? If you are contracting strongly and regularly, your midwife may offer a vaginal examination. If there are any cervical changes consistent with labour, your care will be transferred to delivery suite as soon as the midwife is available to provide one-to-one care. You may not need to have your waters broken or syntocinon infusion. This will be discussed with you. How long will induction take? The length of time varies individually. Some people go into labour quicker than others. Please be prepared that it could take several days to get to the point that you are able to have your waters broken or get into labour. What can you do to help the process? Some of the things that can help most during the induction process is making sure your body is working as well as possible. These can include feeling relaxed and comfortable, so bring cool, loose-fitting clothing, bring your own blanket or pillow from home, or something as simple as nice smelling creams and toiletries can help you feel comfortable. You do not have to stay in your hospital bed space at all times, but being active and getting some steps in around the hospital and grounds helps your muscles work in a normal way, which helps your body during the labour process. Lots of women like to bring snacks or have their partners or visitors bring them meals and drinks, so you are eating foods that make you feel good. Optimising sleep is also important, which we know is difficult in a hospital environment, and some women like to bring in eye masks or earplugs to increase the chances of being able to rest while they get the chance. Bring things in to do such as books, downloading TV shows or movies, headphones for listening to music, or other things that relax you or help pass the time. Are there any risks? Like any drug or medication, induction carries risks which must be balanced against the potential benefits. There are many indications as to why induction of labour has been recommended, and therefore the risks and benefits are very individual and should have been discussed with your midwife or doctor when booking your induction. Rarely women may experience an unusual reaction to the pessary and experience strong contractions without a break in between. This usually happens within the first hour after the pessary has been inserted. This is called hyperstimulation, and the propest pessary will be removed, and we advise using a CTG to monitor your baby's heartbeat. If this happens, a midwife and a doctor will come to explain what is happening and discuss your options with you. The recommendation may be for a medication injection called terbutaline. The aim of the medication is to relax the smooth muscle of the uterus to reduce the frequency of contractions. We are aware that many women often worry about the possible adverse effects of induction of labour, and there is a lot of conflicting advice available. There is often a lot of worry regarding operative delivery. Evidence shows that in a term pregnancy, the process of induction of labour in itself does not increase the chances of caesarean section or assisted delivery. We know induction of labour over expected management also reduces the chances of caesarean section in all women from approximately 41 weeks. The reasons why your induction was recommended, for example having a larger or smaller baby, may however increase the chances of needing operative delivery whether labour is induced or spontaneous. There is very conflicting evidence regarding the pain women experience in induced labour, with studies reporting both reduced and increased pain scores. Your stay in hospital and time in labour is often longer with an induction of labour. Some parts of the induction process of labour may increase the risk of heavier than normal bleeding immediately following the birth of the baby, also known as a postpartum hemorrhage or PPH. Every woman's risk of PPH is assessed at the onset of labour. Those at increased risk will be offered active management of the third stage of labour. This is known as the time between the birth of the baby and the birth of placenta, to reduce the risk of chance of heavy bleeding. Occasionally, despite trying all induction methods, labour may not begin. If this happens to you, a doctor will discuss the next steps. The options might include a further stretch and sweep, resting for 24 hours and starting the propest pessary process again, or caesarean section. Awaiting spontaneous labour is an option available, however this is often not advised due to the reason for your induction. Can I go home during my induction? There is specific guidance on going home during your induction of labour. We can discuss this at the time of booking your induction. The guidance is that you must be low risk and with an induction for post-dates pregnancy only beyond 41 weeks. Live within 30 minutes of the hospital and have access to a phone. You must be able to communicate clearly with hospital staff over the telephone yourself. You have had 3 or less births and the CCG monitoring before and after insertion of the first ProPES or balloon catheter is normal. You will be able to stay at home for your first ProPES or balloon catheter, but if any further medication was needed, then you would need to stay in hospital. We will give you advice of when to call the hospital during your time at home. If you have any further questions about your induction of labour, please ask your community midwife or midwife caring for you on panel ward. Please remember that it is your choice and you can change your mind at any point. Ask questions or ask for advice. We are here to support and advocate for you.